I'm going to call this part one of low testosterone because I could easily go on for hours about this because there are so many different causes and there's primary, secondary, and tertiary. But the first thing I'm going to start this off with is telling you that you don't have low T. That is not a medical diagnosis. In fact, actually, if you don't believe me, I hope you don't, you should go to truthinadvertising.org and you should read what he's written there. This whole concept of low T was made up by pharmaceutical companies and TRT clinics to sell you stuff. Okay? Actual diagnoses, that would be something like primary, secondary, or tertiary hypogonadism. There are a number of causes, and those causes need to be addressed. If you're told that you have low testosterone, yes, you do have low testosterone. I mean, in a quite literal sense, could you have low T? Yeah, sure, you could have low testosterone in the same way you could have high blood glucose, okay? But that's not a medical diagnosis, and you should be asking the question of not, how do I bring it up? You should be asking the question of, why is it low in the first place? Because you could have something like a varicocele. So that is a varicose vein in the vein that goes down to the testicle, and that will actually impair your sperm production as well. And that's very easily fixed. There's ligations, and you can see an interventional radiologist, and they just put a coil in. I mean, it's an outpatient procedure. Like, it's really minor. You can have this fixed, and then your testosterone will go back to normal, and your sperm production will come back. And actually, if you're not careful and you let that thing go, eventually your scrotum will look like a sack of worms because it will spread and it will get worse and it will become painful. So, like, sometimes it's good to fix these things before they become extremely painful. Additionally, as I said in another video, you could have a pituitary tumor. These are benign tumors. It's called a pituitary adenoma. Oftentimes people have what's called a prolactinoma. A prolactinoma means that it's excreting prolactin, which then actually blocks the LH and FSH, luteinizing hormone and follicle stimulating hormone. This is very important that people address these because you can suffer from apoplexy, and that can kill you. Additionally, it can block ACTH, which means that you could have an adrenal crisis, and an adrenal crisis can kill you. There are people out there lying who say that they had a pituitary tumor and they cured it with supplements. No, you didn't. There's absolutely no way that happened. This is very serious. People have to have endoscopic endonasal approach surgery, gamma knife surgery. There's a number of different interventions, but that tumor needs to be removed. You can't just leave that there. That's very serious. Yes, it's a benign tumor. It's not cancerous. It's not going to metastasize, but it actually can kill you because it can impair your adrenal function to the point where you have an adrenal crisis. It can impair your thyroid function. It can impair your growth hormone. It can throw off oxytocin levels. It can throw off your ability, vasopressin. You can end up with diabetes insipidus. This is not a minor thing. This is very serious. And additionally, the last one is tertiary, which is your hypothalamus. And Will Brink has a great article on this. The problem was simply that this young man was overtraining and undereating. And that was actually something that was relatively easy to fix. We're all familiar with the female athlete triad. Well, men get it at 2. I think they've now called it REDS or something like that, REDS. But it's basically just female athlete triad, and it's happening in males. So you overtrain and you undereat, and then suddenly you find yourself in a situation where your hypothalamus is freaking the hell out. You have this extremely high cortisol level, high prolactin levels, and guess what? Luteinizing hormone and follicle stimulating hormone drop. Just like how whenever you have a prolactinoma, the benign tumor, it excretes prolactin, which blocks luteinizing hormone and follicle stimulating hormone, which is why your testosterone level drops. You don't want to have excessively high cortisol levels. You don't want to have excessively high prolactin levels. You should figure out why you have low testosterone in the first place, because that is a serious medical condition oftentimes. There's usually some underlying cause that should be addressed. Now, additionally to this, you could have sleep apnea. Sleep apnea should be addressed. At some point, you will end up with an enlarged left atrium, and this is not good for you. Like, you will have a heart attack at some point if you leave your sleep apnea unchecked. You'll end up with hypertension. You'll have high blood pressure. That'll put strain on your kidneys. If you have low testosterone, you should make sure that you don't have sleep apnea, because there are very serious consequences of sleep apnea. You may have diabetes. You should get your blood glucose checked. You should get your HbA1c checked. You should probably have a glucose tolerance test done. Like, this is another serious thing. Like, diabetes is a very real thing. I don't know why this doesn't get talked about. Diabetes can cause you to have low testosterone levels. if you're diabetic, you should get that checked. And I know we can't talk about obesity, right? Because, the AMA says it's somehow offensive. But the reality is that if you're obese, like, you should make sure that you don't have, like, hypercholesterolemia, diabetes, etc. Because you can end up with, like, a blocked artery or something. You could have a stroke. You could have a heart attack. That's way more serious than whether or not your testosterone level is at 200. Like, your testosterone level being at 200 is not going to kill you, but like a heart attack or a stroke definitely could. So you should definitely make sure that you get that checked. Same thing for sleep apnea. This is like this slow burning that eventually will catch up with you. So low T is not a diagnosis. It's an advertising thing. You should figure out why you have primary, secondary, or tertiary hypogonadism. You should find out what's underlying that. What if you have some micronutrient deficiencies? What if you have low vitamin D? Low vitamin D can actually, if it's low enough, can cause these problems. You should get your magnesium level checked. Like, you should actually take a look and make sure, like, you don't have a thyroid problem, because you could have thyroid cancer. You could have nodules on your thyroid. You could have an autoimmune condition. You could have something like Hashimoto's or Graves that's causing problems for your thyroid. If your thyroid gets screwed up, you won't produce testosterone normally. There are so many things that can cause you to have a low testosterone level. You should immediately stop and ask why, instead of just, how do I bump it back up? And I mean, I have a list here. So, like, sleep, fat intake, carbohydrate intake, calorie intake, stress, micronutrients, too much alcohol. Yes, you can damage your liver drinking too much alcohol. Who knew? We all knew. But that's a real problem. Excessive consumption of seed oils. You can screw up your triglycerides, and you can screw up your blood glucose, and you can screw up a lot of things metabolically, which will cause you to have low testosterone as a symptom. See, low T is a symptom, not a diagnosis. That's the point here. So is low T real? Of course low T is real. You can have low testosterone, but that's not a diagnosis. That's a symptom. You could be overtraining. You could be excessively consuming stimulants like caffeine, ephedrine, etc. In fact, we know that Adderall, everyone's favorite drug that we were all put on as kids, Adderall and Ritalin, that will lower your testosterone level as well. Sleep medications can lower your testosterone level. If you take things like gabapentin can increase your prolactin. You can develop boobs from it. You can develop gynecomastia from taking gabapentin. Certain medications can increase your prolactin levels. You should be very careful. SSRIs, SNRIs, some of the various drugs that we use in people to treat depression can cause you to have low testosterone. I'm not sure, but I kind of feel like maybe you should look at taking a different medication if one of them is causing you to develop breasts. That's probably not a good medication for you. You could have glucose dysregulation. You could have high HbA1c. That's a symptom that's, you're pre-diabetic, or you actually are diabetic. You could have excessively high cortisol levels. Well, excessively high cortisol levels, yes. You could have a tumor on your adrenal gland, or you could have something going on with your pituitary gland. You could have Addison's. You could have the opposite of this whole thing, and you could have Cushing's, which is the high one, Addison's, which is the low one. If you have some issue with your cortisol levels, you can end up with low testosterone as a symptom. You need to address things like Cushing's and Addison's. That's a very serious condition. If you just throw testosterone into the mix, like, well, my testosterone level's normal, and you're missing something like Cushing's or Addison's, like, this is a big problem. And like I said, even like the prolactin, like, you could have a prolactinoma. That's a serious thing. I realize it's a benign tumor. It's not cancerous. It's not going to spread and metastasize to your organs. But this is a very serious thing. And then, of course, we can get into an entire discussion about endocrine disruptors. There's a whole bunch of endocrine disruptors in our environment. But I feel like that should be a video of its own. So this is a quick one where I'm going to talk about how your circadian and stuff like that, like, address your health first. The point that I'm trying to make in this one, and I'm trying to keep this short, and I know that I'm already going too long, but the point is that low testosterone is not a diagnosis, it is a symptom, and therefore you should be looking for things that are causing it. You should be saying, why do I have low testosterone? And then you should go and pursue that. Find out if you have sleep apnea, find out if you have diabetes, and God forbid you have a pituitary tumor. So there's my first chunk of this, and I do plan on making more addressing each of those individually.